I think it is very important that we should protect the environment. We should think about our environment as an extension of our house. Sure ko lang. Hi everyone, welcome back to my channel. So for today's episode of my vlog, I will be sharing to you guys the most important role or the important role played by estrogen in hormone replacement therapy, as you can see in this with the title in this particular vlog. Before anything else, if you're new to my channel, please do not forget to click the subscribe button and also to click the notification bell for you to be notified and updated in my new uploads and upcoming uploads and videos. Hi everyone, welcome back to my channel. So as I've mentioned in my introduction, in this particular video, we will be discussing, or I will be sharing to you guys in this video, the essence or the important role played by estrogen in hormone replacement therapy. But before proceeding in the video, disclaimer, I am not a doctor, I'm not an endocrinologist, I'm also not a person working in the field of medicine. And these ideas I will be sharing to you, it's based on my intensive researches and based on the knowledge I gained upon asking questions from my transgender friends who are successful in hormone replacement therapy. Again and again, disclaimer, I'm not a doctor or endocrinologist. I'm not a doctor or an endocrinologist. Okay, so in undergoing hormone replacement therapy, there are two important medicines that transgenders need to take. So first, we have the estrogen. Second, we have the anti-androgen or the testosterone blocker. In this particular video, we will be focusing only on the importance of testosterone blocker or anti-androgen in hormone replacement therapy. I mean, we will be focusing on the estrogen. Stand to be corrected, we will just be only focusing on the estrogen in hormone replacement therapy. Okay, so estrogen is very important, not just important, but very important. I would like to give emphasis on that because if you take estrogen, you will experience the development of secondary female characteristics, or in other words, you will have the chance to undergo you will be having a chance to undergo the puberty of women, and that is the main purpose of hormone replacement therapy, especially to those persons who have this thing called gender dysphoria. They need to correct that issue or that gender dysphoria through hormone replacement therapy, and the estrogen is really important in order to correct that particular mistake of mind or mindset. Through taking estrogen, you will have the chance to experience or develop secondary female characteristics, and by that, you are one step closer towards fulfilling your dream, feminizing or to be feminine. But there are certain factors to consider in the success of hormone replacement therapy. It is not enough that you're only taking estrogen. You also need to take testosterone blocker, especially if you haven't undergo orchiectomy or if you haven't removed your balls or your balls or testicles or testes, since as long as you have the testes, you will develop, or you still have the male hormone, which is the testosterone, and testosterone is mainly responsible for the development of male characteristics. And in HRT, we don't want to experience further development of male characteristics, so we need to prevent from experiencing those by undergoing HRT and by taking testosterone blocker and by taking estrogen. By the way, guys, I have an additional input. So if you're using estrogen, you have the option to use whether injectable or oral ones. So for injectables, Examples are phenoquinone F injection and yellow-tusha, or the estradiol benzoate. We also have Pruluton, Proguanone, and for the orals, you could use Progainova, Estrofem, and birth control pills, but I don't recommend birth control pills in HRT. Now, in my case before, when I was transitioning, I used combination of both. I use orals, I also use injectables, which is not so good because the overdosage, considering the fact that I'm self-medicating, it is not really good to kind of like use multiple modes of estrogen hormones. I use oral ones and then I also use injectable ones. It's really not advisable because the overdosage, the high risk of the risk of overdosage will increase, and overdosage of estrogen is really not good for our body since estrogen are known to cause coagulation or blood clotting, and this thing called blood clotting could lead to serious health problems such as deep vein thrombosis or deep vein thrombosis, stroke, and myocardial infarction or heart attack. So you really need to choose between orals or injectable, and that will be prescribed by your physician or your doctor concerned of your HRT. If you're undergoing HRT, you're taking estrogen, and you're afraid of this thing called coagulation or blood clotting, you didn't have to worry, sis, because there are a lot of things that you can do, lifestyle change that you can do, or a lifestyle change that you need to implement in order for you to avoid blood clotting or to avoid serious health problems such as deep vein thrombosis, stroke, and heart attack, and many more. And you can do that by having a healthy lifestyle, doing regular exercises, staying active, and eating the healthy food or eating the right food, since HRT is drastic and at the same time risky process. Now, if you're transitioning and you're only taking testosterone blocker, you better stop undergoing such process since it will be useless. You need to take estrogen. Estrogen is indeed very important in hormone replacement therapy, as I've mentioned earlier. Secondary female characteristics that are effects of taking estrogen are breast development, change in fat distribution, and your face becoming more feminine, or a change in the fat distribution in your face. Those are just some of the secondary female characteristics that estrogen can give to you if you're taking it. But then again, there are certain factors to consider for you to achieve your desired purpose in HRT. First is genetic, the hormones you're taking, and your lifestyle. So these factors need to work together in order for you to become successful in hormone replacement therapy. And in my case, I transitioned for almost 2 years, but I already stopped considering my health aspect. I just found out that I have a congenital heart defect, and the endocrinologist advised me to stop undergoing hormone replacement therapy since it is not a good idea and it will be a very dangerous thing for me to pursue undergoing in this drastic process. That is one of the harsh realities of hormone replacement therapy. It is really not meant for all transgender, and not all transgender will pass in this process. Again, to sum up everything, taking estrogen is indeed very important because it will give you, or it will allow you as a transgender to experience the puberty that women got to experience, and also it will help you to develop secondary female characteristics, which is the ultimate purpose of hormone replacement therapy, in order to lessen the gender dysphoria thing that these transgenders are experiencing. So yes, I think I answered the question. I think that would be all, guys. I really hope that you learned something out of this video. If you like this video, Please do not forget to click the subscribe button and the like button, and feel free to give your feedback or comment about this video in the comment section. I'd be willing to listen to your comments and feedbacks, and I think that would be all. Thank you so much for watching. God bless us all. See you in my next video. Goodbye and keep safe, everyone. God bless us all.